Why am I awake and angry at 2:35 a.m. on Monday, Labor Day weekend? That's a great question. Let's unpack it. My name is Kim Fath. I'm the founder and CEO of Healthcare Survival Kit. I am not just a founder. I am not just a CEO. I'm a caregiver. And I'm awake at 2:35 a.m. because I'm so angry. So let's do a root cause analysis of why I'm up at 2:35 and angry. A root cause analysis is when you ask the question why between 5 to 7 times. And when you get to the end of that, you'll know what's truly at the root of what's going on. So let's start at the beginning. Number one, why am I awake? I'm awake because my husband's awake. Why number two? Why is my husband awake? My husband's awake because he's in significant pain. Why number three? Why is he in significant pain? Because we had to go to WakeMed. Why did you have to go to WakeMed? Because he was having symptoms that mimicked a heart attack. Why did WakeMed cause pain? Because why number five, this cardiovascular technician was too busy being the smartest person in the room, not listening to the patient, not listening to the advocate, and simply shoveling people through her process of the day. She is literally a button pusher. She had an inability to listen. She had an inability to read the room. Just because my husband's legs don't work right doesn't mean his communication is broken. It doesn't mean his brain is broken. If she had simply stopped and said, hey, let's talk about what you can contribute to this. Let's talk about what works well. Let's talk about what doesn't work well. Let's figure this out together. Everything could have been so much better. But she didn't. I tried to advocate. She shut it out. And now I regret that because I'm a professional advocate. There were enough people there helping with the transfer. I thought, he's just anxious. I'm just anxious. It's going to be okay. Nope, absolutely not. I should have shut down the process. I should have called for risk management. We are now 6 days out from the first part of that cardiovascular testing. It's a 2-day process. The first day, he came back to the room in agony. The guy who has spent a year relearning how to stand and walk was choking back tears and asking for pain medicine. Those are two things he doesn't do. He just sucks it up and keeps going. But you brought him to tears and you left him begging for pain medicine. You need to learn to do better. Or you need to go get a job where you don't interact with people in a hospital. Because the outcome is my husband's been in pain now for 6 straight days. It's the bottom line. He has been in pain for 6 days. His physical rehab here at home has ground to a halt. He's not able to work through the full day like he was before he met you. Here's the basic outcome. He literally looked at me tonight, choking back the tears in his eyes, and said, I wish we hadn't gone to the hospital to find out if I was having a heart attack. The outcome of this is so bad, I would have just rather flipped a coin to see if I was going to have a heart attack. It wasn't worth it. So let that sink in. And to WakeMed corporately, you need to do better. You need to listen to caregivers. You need to listen to healthcare advocates, and you need to listen to patients. And if you can't do that, then you can't continue to provide medical care. My name is Kim Fath. Feel free to reach out to me. Have a good night. Maybe now that I've said what I need to say, I can get some sleep.